For the patient population that is, women that are about my age, I would say Emsella for preparing to try to conceive for childbirth, because you can't do Emsella while you're pregnant. But if you're thinking about starting a family, being on the Emsella can strengthen your pelvic floor and make childbirth and pregnancy a lot easier, because you're carrying a baby with your pelvic floor muscles. So it's really important for that to be strong before, because the stronger you are before, the easier birth is and the easier the rebound is. So I would say Emsella. Semaglutide obviously is great. Again, can't do it when you're pregnant or breastfeeding, but semaglutide is a great one to do for anybody, whether or not you're about to get married, or you're about to go on a big vacation, or you just went to the doctor and your A1C was slightly elevated, or if your parents have a history of diabetes and you want to make sure you're not going to follow in those footsteps. Lastly, I would advise getting ahead of any chronic sports injuries or even acute injuries, and having seen thousands of patients in their 50s and 60s who are coming in now with these chronic problems that have just snowballed over the past several decades. I think it's really important to be aggressive and proactive in treating any kind of pain that's bothering you now. I personally am going to be getting some PRP done on my low back, not because it's a big problem now, but because I do not want it to be a big problem in the future. And I think it can be very easy to, when you're in your 20s, 30s, 40s, to kind of say, well, I'm young, it's not that big of an issue right now, or I can ignore it, or, I can get a massage or whatever and it's fine for a few days. It's really easy to kind of sweep it under the rug, but these issues are best taken care of when they're small problems, because it is way easier to put out a small fire than a big fire. So I would say, if you can, start doing PRP or HGH now for that thing that nags you every so often, so that it doesn't become your day-to-day life 20 years from now.